ear pain in medical terms is also called otalgia. Okay, now when you talk about ear pain, the ear pain itself is just a sign. So pain anywhere in the body is a sign of something that is, underlying some problem that is causing the pain. So now for ear pain, the problem could be inside the ear, or sometimes the pain is referred from other sides to the ear. So if you talk about pain in the ear, it can be sometimes due to infections of the ear canal, if someone's used earbuds very vigorously, or an impacted wax, sometimes due to children putting, sharp objects inside the ear, or an insect accidentally going inside the ear. All these are causes of ear pain from inside the ear. Also, sometimes infections of the middle ear, that is what we call as otitis media, mainly acute otitis media. That is what causes ear pain. Then, apart from that, we have ear pain being referred from somewhere else. So, if you have pain in the ear without any findings in the ear, then you assume that it is probably referred from somewhere. So, it can be referred from surrounding sites, like, this joint, which is known as the temporomandibular joint. It can be referred from this part of the, face, that is the parotid gland. If there's pain in the parotid gland, that also can be referred to the ear. Also, at times, pain from the teeth can be referred to the ear. Pain from the tongue can be referred to the ear. And sometimes pain from piriform fossa. It's a part, it lies just beside your larynx. So pain from there can also be referred. So any ear pain, you don't have to just give analgesics, but you need to find out the cause for ear pain, and then, treat it accordingly. If you have an inflammation of the ear canal due to various causes, like a foreign body, wax, intentionally using earbud or a pin to trying to clean the ear, some kind of fungal infection, which typically occurs in swimmers, okay, or you have middle ear infections like otitis media, that also acute otitis media, and there's a condition called as malignant otitis externa, which gives rise to intense ear pain, and it is seen in diabetics mainly. So these are the causes of ear pain originating from the ear. Apart from that, if you have pain originating from the joint just in front of the ear, that is the temporomandibular joint, that can give rise to ear pain. You can have pain referred from malignancies or cancers of the tongue, of the jaws, of the piriform fossa or the hypopharynx. So sometimes, the patient might just present with a pain in the ear, and if you ask what are the other symptoms, there's absolutely nothing related to the ear, and that is when you need to, look for the causes of this referred pain. So then you examine the tongue, you do a laryngoscopy, examine the larynx, because you need to find out what is it that is causing the ear pain. If you have symptoms like, apart from the ear pain, if you have a ear discharge, if you have headache, if you have any other symptoms, that means that you're dealing probably with some form of infection, and you need to see an ENT surgeon immediately. So what I would suggest is anyone who has been having ear pain for more than 24 to 48 hours, you must visit your ENT doctor. Maybe you can just take an analgesic to tide over the pain during this time, like a day or two. But do not neglect the ear pain, because I'm trying to stress here that ear pain is just a sign that your body is giving you. There is definitely something underlying that needs to be treated. So do not ignore it and visit your ENT doctor. There are some conditions which are quite serious and associated with ear pain, one of which is this malignant otitis externa. So someone who is a known diabetic and is having very severe ear pain, which is just not coming down with normal analgesics, antibiotics, these people, need further investigations in the form of a CT scan, and may also require intravenous antibiotics after admission in the hospital. So that this is one very serious condition which is associated with ear pain. Apart from that, when you have cancers, of the tongue, of the base of tongue, of hypopharynx. These are also very serious conditions associated with ear pain. And in these people, the pain will never get, the pain will only temporarily get relieved when you give them an analgesic. It will come up the next day. So if you're looking at just an inflammatory condition, the slowly after giving analgesics, the pain will reduce. I mean, in say about 3 4 days, the pain should go down. But in these cases, the pain will not go down. So, again, if you have anything like this, you must visit an ENT doctor. There are some tips that I want to share. One is, do not try and clean the ear. Okay. The max you can do is with your little finger, you can just put it inside your ear, obviously with the nail cut. You can put inside the ear and remove the excess wax which comes out. Normally, during your bath, the wax, just washes out. So don't worry. You don't have to keep cleaning your ear regularly. Some people have an habit of, cleaning their ears every single day. It's absolutely not recommended because wax is a something that your body naturally produces. It is essential because it lubricates the ear. It has some antibacterial properties. So by removing that wax, you are just exposing your ear to infections. Secondly, someone's going swimming, make sure that your ears are dried. So when you, very simple technique is when you take a bath and you're drying your hair, at the same time, you can just hold the hair dryer for a few seconds and, just beside your ear. And that blast of hot air, obviously not very close to the ear, a little away from the ear, that blast of air helps to dry the ears. Someone also using hearing aids must ensure that the ears are dry after a bath before they put the hearing aids. And another thing is when to prevent hearing loss also, if you have to continuously use the earphones and all, it should be less than 60 minutes at a time, and the volume should be below 60%. So these are few tips which you should follow to take good care of your ears.